Introduction. PTSD develops when a person is unable to deal with the trauma-induced distress they encounter. Individuals who have encountered or witnessed a traumatic event are at risk for developing post-traumatic stress disorder. PTSD sufferers frequently deal with invasive and enduring symptoms that make normal functioning difficult. Nightmares, flashbacks to the traumatic incident, and strong emotional and physical reactions to triggers are all signs of post-traumatic stress disorder. They may try to avoid anything that brings up bad memories, and this can lead to a lack of interaction with others. Hyperarousal, or being always on edge, easily startled, and unable to relax or focus, is another hallmark of post-traumatic stress disorder. These heightened states of arousal can make it hard for people with the disorder to unwind or feel comfortable, as they may be on edge all the time. The frequency and intensity of PTSD symptoms can differ from person to person. Some people may get better on their own, while others may need medical attention. Medication, especially selective serotonin reuptake inhibitors, SSRIs, and talk therapies like cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, are also used to treat PTSD. It's crucial to remember that individuals with post-traumatic stress disorder, PTSD, who receive an accurate diagnosis and effective therapy have a good chance of making a full recovery. An increasing number of Americans are suffering from post-traumatic stress disorder, PTSD, which has personal and societal repercussions. The increased exposure to traumatic events in the United States is a major contributor to the high rate of PTSD. Many of the country's servicemen and women suffer from post-traumatic stress disorder after returning from wars overseas. Many people in the United States also suffer from PTSD because they have been victims of sexual assault or violent crimes. Natural disasters significantly increase the risk for post-traumatic stress disorder. Survivors of such tragedies often develop PTSD after experiencing long-lasting psychological effects from the trauma they witnessed and seen others experience. Persistent social problems and difficulties in the country also have a role in elevating PTSD rates. Poor communities and asylum seekers are more likely to experience PTSD. In this book, we will be looking at all you need to know about PTSD and how to thrive regardless of your diagnosis. Chapter 1. A brief history of PTSD. Although PTSD has been discussed in various forms since ancient times, it wasn't until the middle of the 20th century that it was recognized as a mental illness. For instance, ancient Greeks wrote about warriors returning from combat who displayed symptoms similar to post-traumatic stress disorder. A definitive diagnosis for PTSD did not emerge until the 1860s, during the American Civil War. Veterans who had encountered terrible war scenarios were diagnosed with conditions like nostalgia by medical professionals. The mental toll of fighting was recognized more fully during World War I. The tremendous savagery and technology breakthroughs of the war led to an inflow of soldiers suffering from significant psychological discomfort. During this time, the phrase shell shock was developed to characterize the psychological effects of being subjected to artillery fire. After World War II, PTSD received increased attention as medical and psychological research improved our knowledge of the condition. The term combat fatigue was used to characterize the psychological effects of the war. Mental health specialists recognized PTSD outside of military situations when they saw civilians develop identical symptoms after witnessing or experiencing other traumatic events. The public's understanding of post-traumatic stress disorder, PTSD, was significantly shaped by the Vietnam War. Psychological effects such as flashbacks and nightmares were common among returning veterans. As a result, post-traumatic stress disorder, PTSD, was officially recognized by the American Psychiatric Association in 1980, when the DSM-3 was published. And our knowledge of PTSD has grown much since then. Natural disasters, physical or sexual assault, and accidents have all been identified as potential causes of post-traumatic stress disorder. The diagnostic criteria for post-traumatic stress disorder have also been expanded to include a broader spectrum of symptoms and presentations. PTSD is now well recognized as a major mental health issue that affects people from all walks of life around the globe. Significant events, societal shifts, and scientific advances in medicine and psychology have all contributed to our current understanding of post-traumatic stress disorder, PTSD. Changes in culture and society have also had an impact on how widely PTSD is diagnosed and understood. PTSD and other mental health issues were commonly misunderstood and stigmatized in the past. However, thanks to rising levels of public education about mental health, PTSD is now widely acknowledged as a real and serious issue. Chapter 2. Causes of PTSD. Individuals who have encountered or witnessed a traumatic event are at risk for developing post-traumatic stress disorder. Although PTSD's root causes are difficult to pin down and may vary from one person to the next, there are a number of consistent risk factors. PTSD can be set off by anything deemed to be life-threatening, alarming, or physically harmful. Violence, sexual assault, war, natural catastrophes, and terrible accidents are all examples of life-threatening experiences. Also, the chance of getting PTSD might be affected by the severity and length of the threat. PTSD can also be caused by a person's inherent frailty. It's possible that certain people are more genetically or psychologically susceptible to the condition. Anxiety and depression sufferers have a higher risk of acquiring post-traumatic stress disorder. The risk can also rise if there is a history of mental illness in the family. The chance of developing PTSD can also be increased by a lack of social support. Women are more likely than males to experience PTSD. That's why this book is tailored to women, but men can also be at risk. One possible explanation for this is the disproportionately high number of cases of sexual assault among women. Comorbid mental health problems, such as depression or anxiety, are associated with a higher chance of developing PTSD, and women are more likely to have them. Even though these things we have mentioned can play a role in the development of PTSD, it's crucial to remember that not everyone who any of these trauma will end up with PTSD. The reason is because everyone reacts differently to trauma. Warning signs of PTSD. The likelihood of acquiring PTSD after experiencing trauma increases in the presence of certain pre-existing mental health issues, such as anxiety disorders or mood disorders. People who have trouble controlling their emotions may also be at a higher risk for developing PTSD. Personality traits such as a propensity for neuroticism or pessimism have also been linked to an increased risk. The likelihood of getting PTSD can vary depending on the severity of the event and the degree of perceived threat. There is a correlation between the severity of the traumatic experience and the development of the illness. There is an increased likelihood of trauma and PTSD in some professions. The risk of getting PTSD is higher for people who are in professions where they are repeatedly exposed to traumatic situations, such as people in the military, firefighters, police, paramedics, healthcare workers, and journalists reporting from battle zones. PTSD risk might also be increased by social and cultural variables. Discrimination, poverty, and social isolation are all societal issues that can raise a person's vulnerability to trauma. The risk of developing the condition is greatly increased by exposure to traumatic events during childhood, such as physical or sexual abuse and neglect. The likelihood of developing PTSD can also be increased by the existence of additional stressful life events like problems with money, relationships, the death of a loved one. There may be biological links between trauma and post-traumatic stress disorder. It's possible that certain people are more vulnerable due to a predisposed physiological response to stress. Some evidence suggests that changes in the stress response system, such as dysregulation of stress hormones like cortisol, may contribute to the onset of post-traumatic stress disorder, PTSD. There is also a genetic component, with some polymorphisms in genes involved in stress response and emotional regulation being linked to a higher chance of developing PTSD. PTSD is frequently interwoven with substance misuse and other mental health conditions. Substance abuse is a common coping mechanism for people with post-traumatic stress disorder, PTSD. Substance addiction can increase PTSD symptoms and make treatment more difficult. The likelihood of developing post-traumatic stress disorder after experiencing a traumatic experience varies with age. Due to their immature coping skills and lack of life experience, children and teenagers are more susceptible to trauma's damaging effects and may be susceptible to PTSD. Typical signs and symptoms: re-experiencing, avoidance, negative changes in cognition and mood, and hyperarousal are the four main clusters of PTSD symptoms. Trauma flashbacks and unwanted recollections are common indicators of re-experiencing trauma. These can be prompted by sensory cues in the form of sights, sounds, or odors. Those suffering from PTSD may experience distressing flashbacks or nightmares where they relive the terrible event. They may experience severe emotional and physical reactions when reminded of the traumatic event. Those experiencing avoidance symptoms try to avoid thinking about or talking about the unpleasant experience. People with PTSD may want to avoid anything that brings back unpleasant memories of the traumatic event. They may try to avoid thinking about it or reliving it, and they may eventually become emotionally numb. Changes in one's thoughts, beliefs, and feelings after experiencing trauma are referred to as negative alterations in cognition and mood. Constantly having a bad attitude about oneself, other people, or the world fits into this category. Individuals with PTSD may internalize the trauma in the form of guilt, shame, or blame. They could lose interest in things they used to enjoy and have trouble feeling excited and happy. Increased levels of alertness, both physically and mentally, characterize the symptoms of hyperarousal. People with post-traumatic stress disorder, PTSD, are more likely to have an increased startle reaction, meaning they are more readily frightened by loud noises or sudden movements. They may have trouble sleeping, impatience, temper explosions, and trouble focusing. When people are always on edge due to hyperarousal, it can be difficult for them to calm down and feel secure. The severity and persistence of PTSD symptoms can vary greatly between individuals, and not everyone who suffers trauma will acquire the disorder. Moreover, these signs and symptoms often coexist and change over time. A person's daily functioning, relationships, and quality of life can all be severely impacted by PTSD. There are other common indications of PTSD in addition to the main symptoms we just outlined. Emotional dysregulation is one of these symptoms. People with PTSD may have trouble controlling their emotions, which can lead to extreme and irrational outbursts. They might experience intense outbursts of emotion like rage, despair, fear, or guilt. The emergence of anxiety and panic disorders is another sign. People with post-traumatic stress disorder, PTSD, are more likely to suffer from anxiety and panic episodes. They may become more easily frightened and avoid what they view as potentially dangerous situations or places. Anxiety symptoms can be persistent and get in the way of regular life and health. The inability to trust others and experience emotional safety in relationships is one symptom of the disease. People with PTSD may experience challenges in making and keeping close friendships, or they may retreat from social situations. And the emotional toll of PTSD can be compounded by feelings of disconnection and isolation. People who suffer from PTSD may also be more likely to act in harmful ways to themselves. Substance misuse, self-harm, and other potentially harmful behaviors are all ways that they might try to alleviate the stressful effects of their condition. Although these tactics may temporarily alleviate PTSD symptoms, they frequently set off a domino effect of bad outcomes and make managing the disorder even more difficult. Chapter 3. Trauma Categories. Those who have encountered terrible events during military battle are at risk for developing combat-related PTSD. It develops when people are subjected to horrific experiences, such as war and other situations where their lives are in danger. Combat-related PTSD is characterized by flashbacks to horrific experiences. Flashbacks, nightmares, and intrusive thoughts can make traumatic experiences feel like they're happening all over again for survivors. Intense sounds, specific odors, or even visual signals that are similar to the traumatic experience can all set off these unwanted flashbacks. This constant barrage into their lives might cause them to feel terrified, helpless, and on edge all the time. Those suffering from PTSD as a result of their time spent in battle frequently show signs of heightened arousal and hypervigilance. They are always on the lookout for potential threats and brace themselves for the worst. Sleep disturbances, impatience, explosive rage, and heightened startle reactions are all symptoms of hyperarousal. This constant state of readiness, as if still in conflict, may be taxing on their minds and bodies. Combat-related PTSD often manifests itself in the form of avoidance. Those who have experienced trauma may go to extreme measures to prevent themselves from being exposed to any reminders of the ordeal. As a defense mechanism, they may withdraw from social situations, stop engaging in hobbies they once enjoyed, or become emotionally numb. Combat-related PTSD has a significant effect emotionally. The remorse, humiliation, and survivor's guilt that survivors endure is often crippling. They may start to second-guess themselves and the choices they made during the traumatic experience, which can lead to feelings of guilt and low self-esteem. Close relationships may suffer if survivors have trouble trusting or opening up to their spouses emotionally. They could have trouble getting along in school or keeping a job because of issues with focus, memory, and decision-making. To alleviate the suffering and find relief from the uncomfortable symptoms, substance misuse and other self-destructive behaviors may emerge as coping methods. Cognitive behavioral therapy, CBT, and eye movement desensitization and reprocessing, EMDR, are two examples of trauma-focused therapies that can aid patients in working through their traumatic experiences and learning new coping mechanisms. Medication, such as selective serotonin reuptake inhibitors, SSRIs, may be recommended to treat symptoms like depression and anxiety that occur alongside this condition. A veteran's loved ones and fellow service members can be an invaluable source of support during this time. Helping survivors reestablish a sense of connection and trust can be achieved by providing a secure and understanding space in which they can freely express their emotions and get validation. Reintegration into civilian life and the restoration of a sense of purpose can also be aided through rehabilitation programs and vocational training. Childhood trauma, physical or sexual abuse, neglect, witnessing domestic violence, living through a natural disaster, or the unexpected death of a loved one are all examples of traumatic occurrences which can be referred to as childhood trauma. The effects of childhood trauma on the maturing brain and psychological health are crucial. The development of secure bonds and relationships can be hampered by the disruption of a child's sense of safety and security, which is common among trauma survivors. They may have trust issues and find it challenging to form and keep friendships. Self-perception and self-esteem can be severely impacted by traumatic experiences in childhood. Children who are subjected to trauma on a regular basis may develop self-deprecating attitudes and come to believe that they are not deserving of affection and support. Childhood trauma can also cause problems with learning and memory, as well as disruptions in focus and attention. The student's academic performance may decline, which could start a vicious cycle of frustration and setbacks. It can affect many areas of a child's life when they become an adult. Codependency, a fear of intimacy, or a propensity to recreate traumatic experiences are all ways in which trauma can make relationships difficult during adulthood. Childhood trauma survivors may also be at a higher risk for developing chronic diseases or experiencing psychosomatic symptoms later in life. An individual's ability to control their emotions and maintain good mental health might be profoundly affected by traumatic experiences they endured as a child. Many people who have overcome childhood trauma also struggle with emotional dysregulation. Because of this, they may have rage outbursts, extreme mood swings, or a pervasive feeling of emptiness, all of which can be detrimental to themselves and those around them. A person's sense of self, others, and the environment can all be affected by their exposure to trauma in childhood. They may come to believe harmful things about themselves, like that they are fundamentally flawed or unworthy of love and affection. They may act in ways that are counterproductive to their own well-being because of the weight of these long-held convictions. Childhood trauma can have physical signs in addition to psychological and emotional effects. Traumatic stress and anxiety can exacerbate pre-existing conditions like migraines, chronic pain, irritable bowel syndrome, and weakened immunity. Keep in mind that everyone's reaction to trauma is different, and that everyone's experience of childhood trauma is distinct. The degree of trauma, the frequency with which it occurs, the existence of coping mechanisms, and the strength of the individual are all variables that affect the aftermath of trauma. The good news is that it is possible to overcome the effects of traumatic experiences in childhood. Individuals can cultivate resilience, coping techniques, and a sense of empowerment with the help of appropriate therapy, resources, and support. Sexual and domestic abuse. Sexual assault and domestic abuse has far-reaching consequences, including severe trauma, PTSD, despair, anxiety, and feelings of guilt. Trusting others, developing close connections, and regaining a sense of safety and self-worth are all extremely challenging for survivors. The stigma, silence, and terror that surrounds sexual assault and domestic abuse are mirrored in each other. Fear of vengeance, social stigma, a lack of assistance, and mistrust in the legal system are only some of the obstacles victims encounter when trying to disclose these crimes. Another factor that keeps survivors from getting treatment and keeps the cycle of violence going is cultural and societal standards that promote victim blaming. Collectively, we need to promote a culture of empathy, respect, and zero tolerance for violence in order to end sexual assault and domestic abuse. There is an increased risk of physical, emotional, and behavioral difficulties in children who are exposed to or experience domestic violence. Natural disasters. Natural disasters such as earthquakes have changed the lives of countless people and permanently scarred entire communities. Earthquakes are caused by the shifting of tectonic plates deep inside the Earth's crust. The magnitude, depth, and closeness of an earthquake to populated areas all contribute to its deadly potential. Cities have been leveled to the ground, and lives have been lost as a result of major earthquakes. Volcanic eruption can have devastating effects on the areas in its immediate vicinity. Towns and villages are destroyed as lava flows, pyroclastic surges, and ash clouds wreak havoc on the countryside. Volcanic activity has far-reaching consequences, including long-term repercussions like soil fertility loss and altered ecosystems, in addition to the obvious physical harm. Tropical cyclones include hurricanes, typhoons, and cyclones, and are destructive storms that develop over warm ocean waters. They can wreak havoc along coastlines with their high winds and heavy rains. Storm surges, or large waves that break on the shore and cause flooding and shoreline erosion, are a constant threat to coastal cities. Strong winds can knock down trees, destroy structures, and cut off large regions from electricity and resources. Floods are one of the most common and deadly natural disasters. Riverbanks and large areas of land are submerged when rivers overflow their banks as a result of heavy rainfall or dam failure. The fast and powerful nature of flash floods makes them an urgent danger to people and property. Prolonged floods can have a subtle but significant effect on towns, displacing residents, destroying infrastructure, and leading to substantial financial losses. Accidents can have just as catastrophic of an effect as natural disasters. The effects on the environment and human health from industrial mishaps like chemical spills and nuclear meltdowns can be devastating. Loss of lives and property can also be caused by transportation mishaps like plane crashes and train derailments. The potential for massive destruction and terrible outcomes is amplified by the high velocity of these incidents. Our capacity to forecast natural disasters has been substantially improved by technological developments, which in turn has allowed for earlier warnings and safer evacuations. Advanced satellites, weather prediction models, and seismic monitoring networks all collect data that can be used to better assess danger and prevent needless loss of life. And a reduction in these disasters means less occurrences of PTSD. Chapter 4. PTSD Diagnostic Criteria. PTSD is defined by a variety of symptoms that fall into 4 broad categories for the purposes of diagnosis. Intrusive symptoms make up the first group. Trauma-related memories, flashbacks, or nightmares can return frequently and painfully for people with PTSD. They may also have strong emotional or physical reactions when reminded of the traumatic event. These persistent symptoms can be debilitating and make it difficult to go about one's normal activities. The second set of symptoms include trying to avoid situations. People with PTSD may want to avoid anything that reminds them of the horrific experience. They may have trouble remembering key details of the traumatic experience and may want to avoid locations, people, and activities that bring back unpleasant memories. As a coping tactic, people may engage in avoidance behavior in an effort to lessen the impact of upsetting triggers. The third group consists of emotional and mental changes for the worse. Negative beliefs about oneself, other people, or the world are common among those who suffer from post-traumatic stress disorder. It's possible they're thinking and feeling irrationally guilty, blaming, and ashamed. They may also lose interest in things they used to like doing and develop a numbing sense of isolation. Changes in reactivity and arousal make up the fourth group. Those suffering from PTSD may act more aggressively or irritably than usual. They can have trouble focusing, have trouble sleeping, or act too alert. They may also have a heightened sensitivity to noise, making them jumpy and on edge all the time. In order to be diagnosed with post-traumatic stress disorder, PTSD, a person's symptoms must have persisted for at least a month and have caused considerable impairment in social, occupational, or other critical areas of functioning. PTSD can manifest itself in a variety of ways for various people. Likewise, there is a spectrum of symptom severity from mild to severe. Correctly diagnosing and treating post-traumatic stress disorder, PTSD, requires a comprehensive evaluation by a trained mental health expert. The diagnostic criteria for PTSD take into account more than just the 4 symptom clusters. It's important to remember that some people experience delayed onset of symptoms, in which the trauma's effects don't become apparent until months or even years later. The diagnostic criteria also emphasize ruling out the possibility that a patient's symptoms are the result of drug use, treatment, or another health issue. This indicates that the physiological effects of a chemical or a medical condition cannot be the exclusive explanation for the symptoms. PTSD is a co-occurring mental health illness, just like depression, anxiety disorders, and addiction. Because they may either amplify or hide PTSD symptoms, comorbid illnesses can make diagnosis and therapy more challenging. A thorough evaluation by a licensed mental health professional is necessary for a definitive diagnosis of post-traumatic stress disorder, PTSD. The diagnostic criteria for PTSD stress the importance of the individual's first-hand experience or witnessing of the traumatic incident. Death, serious injury, or sexual violence must have occurred or been threatened for the event to qualify. The individual's subjective reaction to the traumatic incident is also considered. They must have felt extreme levels of fear, helplessness, or terror either during or immediately after the traumatic occurrence. Also, the signs and symptoms of PTSD shouldn't be more easily explained by any other mental illness. It's crucial to tell PTSD apart from diseases like acute stress disorder, adjustment disorders, and anxiety disorders that may share similar symptoms. The diagnostic criteria also acknowledge that PTSD symptoms in children may look different from those in adults. Traumatized children may have nightmares that are upsetting while having no discernible meaning, act out the horrific experience through play, or regress behaviorally. It's important to keep in mind that studies on trauma and PTSD are always developing. As more information about the condition becomes available, the diagnostic criteria and our understanding of it may evolve. The significance of expert diagnosis. PTSD requires a professional diagnosis. It's a vital entry point for people in need of excellent treatment and assistance after experiencing trauma. Self-diagnosis or relying on anecdotal evidence can be appealing, but getting a professional opinion is crucial. A professional diagnosis acknowledges and validates a person's experiences. A mental health professional's diagnosis not only verifies the presence of PTSD, but also recognizes the significance of the traumatic experience to the person's well-being. The development of a unique treatment strategy is also an essential part of expert diagnosis. Psychological methods like cognitive behavioral therapy, CBT, and medical care are both viable choices for treating post-traumatic stress disorder, PTSD. A proper diagnosis ensures that each patient receives care that is specifically designed for their condition. Also, having a professional make a diagnosis might help you become connected with further resources. The diagnostic process itself is highly therapeutic. It's a place where people don't have to worry about being judged as they open up about their own personal challenges, anxieties, and insecurities. Talking to an expert about a horrific event can be a liberating and life-changing experience. It enables people to reflect on their own experiences, draw links between their symptoms and the trauma they've endured, and learn more about the impact the trauma has had on their life. Also, obtaining a professional diagnosis for PTSD can provide access to a variety of effective treatment options. Mental health experts can use their knowledge to decide which treatments will be most helpful. Some examples of possible psychotherapeutic methods are EMDR, movement desensitization and reprocessing, exposure therapy, and cognitive restructuring. In some circumstances, medication may be necessary to treat both primary and secondary symptoms. Therapies for PTSD. An effective treatment for PTSD is cognitive behavioral therapy, CBT. The goal of cognitive behavioral therapy, CBT, is to help people heal from and move past traumatic experiences by changing the way they think, feel, and act. CBT's goal when used to post-traumatic stress disorder is to aid patients in making sense of how their reactions to the traumatic experience influence their way of thinking, feeling, and acting. An evaluation of the patient's symptoms and history of trauma is the first step in therapy. During this first stage, the foundation for a fruitful therapeutic partnership is laid. After a solid groundwork has been laid, PTSD symptoms can be treated using a variety of CBT methods. Cognitive restructuring is a frequent method, which entails recognizing and disputing inaccurate or unhelpful beliefs about the trauma. The therapist helps the patient become aware of and discard destructive thought patterns in favor of more rational, practical ones. Exposure therapy is also a crucial part of CBT for PTSD. It entails the controlled reintroduction of traumatic memories, circumstances, or stimuli to the patient over time. Individuals learn to withstand distress and create new, healthier coping mechanisms by facing their fears related to the traumatic incident. Avoidance behaviors are often linked to PTSD, but can be effectively treated using CBT's behavioral therapies. The therapist works with the patient to create a plan for resuming previously avoided activities and social situations. To aid its patients in dealing with anxiety and other negative emotions, CBT may also employ relaxation techniques. Reducing the severity of trauma-related symptoms can be accomplished by the practice of relaxation techniques, such as deep breathing, progressive muscle relaxation, and mindfulness. The therapist works directly with the patient, offering encouragement, direction, and psychoeducation related to PTSD. The therapist may also instruct the patient in methods of avoiding triggers, controlling stress, obtaining restful sleep, and bettering general health and well-being. Individuals with PTSD may benefit more from receiving CBT in an individual or group setting. Therapy may last for a varying amount of time, depending on the individual, but it will always follow a set of guidelines and have clear endpoints. EMDR and art therapy. Eye movement desensitization and reprocessing, EMDR, has attracted a lot of attention over the years. The traumatic memories of individuals can be processed and their distressing consequences mitigated through the use of EMDR, which incorporates aspects of cognitive therapy, exposure treatment, and bilateral stimulation. The therapist facilitates reprocessing of the traumatic experience and reduction of accompanying symptoms by guiding the client's eye movements while they focus on the memory during an EMDR session. Another new method with promising results in the treatment of PTSD is art therapy. Artistic materials like painting, sketching, and sculpture are used in this therapeutic approach to tap into the healing potential of the creative process. Art therapy allows people to process and express their traumatic experiences in a safe and non-threatening environment. Innovative treatments for post-traumatic stress disorder, PTSD, include virtual reality therapy. Individuals who have experienced trauma can benefit from exposure to simulated scenarios that are similar to those they experienced in immersive virtual environments. Through exposure treatment, patients are able to safely address and work through painful memories over time. The emotional anguish associated with PTSD can be lessened by the use of virtual reality therapy, which helps patients desensitize to their triggers. Animal-assisted therapy, including interactions with therapy dogs, has also been demonstrated to be beneficial for people struggling with post-traumatic stress disorder. Anxiety and feelings of unease can be alleviated, and a sense of calm can be restored by the presence of a therapy dog. Positive psychological and physiological outcomes have been linked to positive interactions with therapy dogs. These are just a few examples of cutting-edge, non-conventional treatments that can be used in tandem with more conventional therapies for PTSD. However, while some methods have shown potential, not everyone will benefit from the therapy mentioned above. As a result, it's important to collaborate closely with mental health professionals to find the best treatment plan for each individual. Sensorimotor psychotherapy is a form of therapy that combines verbal therapy with more body-oriented methods. The relationship between internal experiences, such as feelings and traumatic recollections, is the main focus. Sensorimotor psychotherapy aids those suffering from post-traumatic stress disorder, PTSD, by focusing on the physiological effects of trauma. Similar to VR therapy, virtual reality exposure therapy, VRT, uses simulations of traumatic situations to help patients work through their reactions to them. VRED promotes desensitization and symptom reduction by putting patients in virtual reenactments of their traumatic events, where they can gradually address and process their fears. Yoga and meditation are two examples of mind-body practices that may help people with post-traumatic stress disorder. These methods help you calm down, tune into your body, and keep your emotions in check. Mindfulness meditation encourages being in the here and now and letting go of judgment, while yoga emphasizes physical postures, breathing exercises, and meditation. Those suffering from post-traumatic stress disorder, PTSD, may also find relief through adventure therapies like rock climbing, hiking, and wilderness adventures. Narrative exposure therapy, NET, is a form of structured therapy in which the patient writes out a detailed account of their life up to and including the traumatic events. Individuals are helped to make sense of their lives by being directed through the process of creating a narrative out of their experiences. The therapeutic use of dance and movement with the purpose of releasing pent-up feelings and emotions is also another method. Individuals can better access and process traumatic memories, improve body awareness, and strengthen connections between body and mind through guided movement exercises. Acupuncture and other forms of traditional Chinese medicine have been investigated as potential supplementary methods for treating post-traumatic stress disorder. To restore energy flow and balance, acupuncture uses the insertion of very thin needles into particular places on the body. It's been shown to aid with stress and insomnia. While these methods have shown potential, the degree to which they help any given individual may vary. Working with experts who can modify treatment plans based on patient input is crucial. Medication for PTSD. Therapy and medication are often used together in the treatment of PTSD. Selective serotonin reuptake inhibitors, SSRIs, are widely used to treat PTSD. These antidepressants are effective because they raise serotonin levels in the brain, which in turn helps control mood and lessens anxiety. The FDA has authorized the use of SSRIs such as sertraline, fluoxetine, and paroxetine. Symptoms like irritability, aggression, and intrusive thoughts can be addressed with the help of antipsychotic medication. Atypical antipsychotics like risperidone and quetiapine have proved particularly useful. Mood-regulating and arousal-lowering drugs like these may have unwanted side effects including increased appetite or sleepiness. Clonazepam and alprazolam are two examples of the benzodiazepines that doctors may recommend for the short-term alleviation of anxiety. However, they should be used cautiously because of the risk of dependence and the possibility that symptoms will develop over time. Prazosin, a drug often used to treat hypertension, has also been investigated as a potential treatment for PTSD. Individuals with PTSD who take prazosin report fewer nightmares and better sleep. Individual differences such as the intensity of PTSD symptoms, the presence of co-occurring illnesses, and the possibility for drug interactions must be taken into account while deciding on a treatment plan. Individuals and their healthcare providers should weigh the advantages, risks, and contraindications of any drug before deciding to use it. Medication alone is not viewed as adequate treatment for post-traumatic stress disorder. In addition to medication, psychotherapeutic methods like cognitive behavioral therapy, CBT, movement desensitization and reprocessing, EMDR, and prolonged exposure therapy are routinely prescribed for the treatment of PTSD. Not everyone who suffers from post-traumatic stress disorder needs to take medication. Medication may be prescribed for those with moderate to severe symptoms or for those who have not responded satisfactorily to therapy, whereas mild cases of PTSD may be effectively controlled via therapy alone. Second, how long a patient must take a drug depends on his or her unique circumstances. While some people can benefit from taking medicine for a limited time to alleviate severe symptoms, others will need to take medication on a more permanent basis. In order to determine the medication's efficacy and make any required adjustments, regular monitoring and follow-up with a healthcare provider are essential. It is recommended to begin medicine with a low dose and increase it gradually as directed by a medical practitioner. The patient can gauge their own reaction to the drug and reduce the likelihood of adverse reactions. The potential for adverse effects varies widely among medications. Nausea, headache, sleepiness, and sexual dysfunction are common negative reactions to SSRIs and SNRIs. Talking to your doctor about the possibility of side effects and reporting any severe or persistent ones will help you get the best treatment. Medication should be part of a larger treatment plan that also includes therapy due to the complex nature of post-traumatic stress disorder. Chapter 5: PTSD and Relationships. Relationships and other social interactions can be especially difficult for people living with post-traumatic stress disorder. Understanding and expressing your needs and boundaries is crucial to navigating relationships when dealing with post-traumatic stress disorder. Hypervigilance, flashbacks, nightmares, and emotional sensitivity are all symptoms of post-traumatic stress disorder that can make it difficult to interact with others. It's important to let your loved ones know about your triggers and sensitivities so that they can better understand what you're going through and offer assistance. It can be difficult for people with PTSD to start and keep relationships going. Avoidance or isolation may result from the fear of being vulnerable or of facing more trauma. To overcome social anxiety, one may need to expose oneself to new settings gradually and rely on supportive loved ones. Relationships thrive on open lines of communication. Understanding and empathy can only grow when people feel safe enough to express their feelings and needs without triggering others. Communicating openly and honestly with loved ones can aid in their understanding of the effects PTSD has on your daily life and the difficulties you may experience. Although encouragement from friends and family is priceless, it is equally essential to get expert assistance. Expert trauma and PTSD therapists can help by providing direction, skills for coping, and a secure environment in which to examine how trauma has affected your interpersonal relationships. Navigating relationships while experiencing PTSD requires a great deal of patience. It takes time to heal, and there may be setbacks along the way. Having supportive people in your life who are sympathetic, understand you, and respect your limits may make a huge impact. Practicing self-care is crucial while juggling the effects of PTSD on interpersonal relationships. Activities that let you unwind, express yourself, and feel good emotionally might have a beneficial effect on your stress and anxiety levels. When you take care of your body and mind, you can be more present in your relationships. Communicating the nuances of post-traumatic stress disorder to people who don't have it can be a significant obstacle for people in relationships. Triggers and symptoms of post-traumatic stress disorder might be difficult for those who have not experienced trauma themselves to understand. Remember that informing others about your health is a voluntary action, and that you are under no obligation to share details about your illness that make you feel uneasy. However, sharing some of your story with others who are willing to listen can help cultivate empathy and build a welcoming community. The effects of PTSD on close relationships and trust are another factor to think about. The ability to trust others and make meaningful connections can be severely damaged by traumatic experiences. Maintaining friendships, let alone romantic ones, can be difficult. It's important to give yourself time to heal, so try to be patient. Healthier relationships can be fostered through the gradual establishment of trust and the establishment of clear boundaries. Increased nervousness and attentiveness can cause problems interacting with others or going places. Preparation, sharing worries with supportive loved ones, and formulating plans to deal with potential triggers can all assist. It's important to surround yourself with sympathetic people who can offer words of encouragement and practical help when times are rough. Taking care of one's emotional and physical health is crucial for reducing distress and increasing social support. This includes doing things like learning how to relax, doing things that make you happy, and being kind to yourself. Taking care of oneself improves your relationship skills and resilience against adversity. It's crucial to remember that dealing with PTSD is different for everyone. The things that help one individual may not help another. It's important to find a treatment plan, therapy, and support network that works for you specifically. You are not your trauma or your illness, and it is possible to heal and form healthy bonds with others. Methods of self-care and coping. Managing the symptoms of post-traumatic stress disorder, PTSD, is no easy feat. Intrusive thoughts, flashbacks, hypervigilance, and emotional distress are all indicators of post-traumatic stress disorder that can have a significant influence on a person's ability to function normally. However, people can learn to manage their symptoms and speed up their recovery with the aid of coping skills and self-care strategies. Making one's surroundings secure and encouraging is crucial, and helping those with PTSD recover. One way to achieve this goal is to build a routine that can be relied upon to be the same every day. Maintaining a consistent routine of sleep, eating well, and doing things that offer pleasure and relaxation can help keep one's emotions in check. Having a safe and peaceful place to retreat to, such a room at home or a favorite park, may be a great help in times of stress. Having a solid network of people who care about you is also important in overcoming PTSD. You can do this by talking to someone you trust, such as members of your family, close friends, or members of a support group. Talking to people who have been through similar circumstances might help one feel less alone and more accepted. Self-care practices can be very helpful in the management of PTSD symptoms. Physical activity, such as walking, yoga, or swimming, practiced on a daily basis can help alleviate stress and anxiety. Relaxation and a sense of stability in the here and now can be fostered by practices including deep breathing, meditation, and progressive muscle relaxation. Another way to express yourself and let out pent-up feelings is through artistic pursuits like writing, drawing, or playing an instrument. To control PTSD symptoms, it is essential to use several coping strategies. Some of these methods involve recognizing and questioning unhelpful ways of thinking in order to replace them with more positive and practical alternatives. Seeking professional support from therapists who specialize in trauma-focused therapies, such as cognitive behavioral therapy, CBT, or on movement desensitization and reprocessing, EMDR, can be helpful in dealing with PTSD. Prioritizing one's own needs and establishing appropriate limits are also essential components of self-care. Understanding when to take a breather, reward oneself, and show kindness to oneself is crucial. Stress and emotional health can be improved by partaking in pleasurable activities like reading, taking a bath, or listening to calming music. Also, making good lifestyle choices can boost health in general. Eating healthily, getting plenty of sleep, avoiding excessive exposure to stressful triggers or events, and minimizing alcohol and drug use are all part of this. One of the most important things you can do to deal with post-traumatic stress disorder is to educate yourself about it. Individuals can take charge of their own healing when they have accurate information about their symptoms, their causes, and their treatment alternatives. With this information in hand, people may zero in on their unique triggers and create effective responses. Healing relies a lot on keeping positive relationships intact. Having people who accept you for who you are, who will respect your boundaries, and who will cheer you on may do wonders for your mental health. Always cherish your healthy relationships. Chapter 6. Tips for fast recovery. Building a support system is an important part of the healing process. Setting boundaries is also important. Taking care of one's physical, emotional, and mental health requires setting boundaries, building healthy habits, and learning self-care techniques. By taking back control of their lives, people are able to reestablish their faith in themselves and the world around them. Part of getting better is getting back in touch with yourself and other people. When people take the time to reflect on their own lives, they have a better understanding of their own feelings, weaknesses, and strengths. They develop an intimate familiarity with themselves and gratitude for their experiences by practicing self-compassion and self-acceptance. At the same time, healing requires mending broken relationships. Some ways to do this include by encouraging open and honest communication, participating in group activities that bring people together. Validation, support, and a revitalized sense of purpose can be found via fostering meaningful connections with loved ones. Individuals gain strengths, resilience, and insight as a result of their experiences during the healing process. They become more resilient, mature, and self-aware as they learn to overcome challenges and grow as individuals. This development gives individuals a reason to keep going, and it may even motivate them to help others who are also seeking recovery. It is common for people to employ a wide range of techniques and methods to aid in their own healing and recovery. Self-care is an important component. Taking care of one's mind, body, and spirit means making things like physical activity, dietary changes, enough rest, and mental practices like meditation and mindfulness top priority. When people take the time to care for themselves, they create a safe haven in which they may focus on their own needs and refuel their batteries. Healing can be greatly aided by therapeutic therapies. Seeking professional therapy or counseling provides a secure and encouraging space for individuals to process their feelings and thoughts about their lives. Guidance, emotional processing, and coping mechanisms are all things that therapists can help their clients with. Cognitive behavioral therapy, CBT, trauma-focused therapy, and expressive arts therapy are just a few examples of the many types of therapy available. Healing and restoration can be aided by using holistic treatment techniques. Yoga, meditation, acupuncture, and other energy healing methods like Reiki can help you unblock your emotions, calm down, and feel better in general. Creating something, whether it be a piece of art, a song, or a piece of literature, is a great way to express yourself and work through your feelings. The ability to forgive is a crucial part of the recovery process. Forgiving means no longer holding grudges or being self or other critical. To forgive is not to excuse wrongdoing, but rather to release oneself from the mental and emotional stress caused by holding a grudge. Individuals can heal and progress towards a more compassionate and peaceful future by choosing to forgive. Gratitude practice and the pursuit of meaning in challenging circumstances are other factors that promote recovery. Gratitude is the intentional recognition and enjoyment of life's pleasant features, even in the face of adversity. Reframing negative events in a positive light can help people become more resilient and optimistic. Similarly, a quest for one's life's meaning and purpose can serve as a beacon and fuel fast recovery. It is essential to treat oneself with compassion and patience during the healing and rehabilitation process. Healing is a gradual, non-linear process that requires patience. When people are kind and accepting to themselves, they make a safe space for themselves to grow and heal. Providing care for those affected by post-traumatic stress disorder. Helping a loved one through PTSD is difficult, but essential. You can be of great help to a friend or a family member struggling with post-traumatic stress disorder by learning about the disorder, educating yourself on it, talking openly and empathetically, and encouraging and facilitating treatment. The ability to trust others, make and keep positive social ties, and keep one's emotions in check can all be severely impaired by PTSD. People with PTSD may withdraw, get angry, or experience mood swings as a result of flashbacks, nightmares, and hypervigilance. You can approach the problem with more compassion and patience if you are aware of these symptoms and how it affects your loved one with PTSD. Supporting someone with PTSD requires clear and empathic communication. Actively listen without passing judgment so that they can share their thoughts and feelings freely. Initiate talks and be understanding if they don't want to talk about specific parts of their trauma. It's best not to jump to conclusions or try to fix their issues for them, as doing so might be dismissive. Instead, provide comfort, understanding, and a safe place where they won't be judged for expressing their feelings. One helpful way to offer support is to learn more about post-traumatic stress disorder, PTSD. Spend some time studying the signs and causes of the disorder. The difficulties your loved one may encounter can be better understood if you are familiar with the effects of trauma on the brain and body. You will be better able to direct them to proper professional help if you are knowledgeable about available services and treatment alternatives. It is critical that people with PTSD be encouraged and helped to seek therapy. Get your loved one into trauma therapy or counseling as soon as possible. Propose going with them to their appointments or helping them locate qualified mental health professionals. Remind them to take things slowly and to celebrate even the smallest victories along the road to recovery. Helping a loved one who is suffering from post-traumatic stress disorder demands patience, compassion, and understanding. Take care of yourself. This is especially important while helping someone with post-traumatic stress disorder, PTSD. Be sure you can give them your full mental and physical attention by getting enough rest. To prevent burnout, it's important to take time for self-care, surround yourself with positive people, and establish reasonable limits on your time and energy commitments. It's important to remember that getting better from post-traumatic stress disorder might take a long time. Avoid pressuring your loved one to get over their trauma quickly and instead be gentle with them. Recognize that recovery is a process that can involve setbacks. Always be there to provide encouragement and reassurance. Assist in providing a secure setting, as people with PTSD may be hypersensitive to stimuli that remind them of traumatic events. Collaborate to reduce anxiety and stress by eliminating potential sources of stress. You should encourage them to do things that make them happy, like working out, making art, or keeping a journal. Help them discover constructive ways to deal with their feelings. Help your loved one build a community of people to lean on by getting them in touch with others who have been through what they're going through. A sense of belonging, acceptance, and comprehension can be found in support groups or internet forums. Learn about potential trauma triggers and avoid them in your dealings with a person who has experienced trauma. Acknowledge and appreciate your loved one's progress, however tiny, because every little bit counts. Acknowledge their toughness, progress, and healing attempts. Marking progress with a party can be a huge morale booster on the road to recovery.